Well, welcome everybody. We are so glad that you are here joining us today. We're going to be hearing a lot of information, and this is a second part of our discussion regarding mapping the mental health of Illinois, spotlighting the Cook County results. I'm Joyce Bartz. I'm with the Mental Health of America of the Northern Suburbs, and I'm going to be moderating this program today. Just a reminder to all of you that this event is being recorded, so please keep yourself muted unless during the question and answer time that we'll be having. Feel free to drop your questions in the chat at any time so that our presenters can answer them during the Q&A. We'd like to recognize the sponsors of our webinar, which include Mental Health of America, Lundbeck USA, Mental Health of America of Illinois, Mental Health of America of the Northern Suburbs. So background regarding this presentation. In 2014, Mental Health America launched an online mental health screening program that screens for several mental health conditions. Approximately 1 million users took the screen each year. In 2020, the number of users dramatically increased, and the results of those screens were more severe. Last year, with support from the pharmaceutical company Lundbeck USA, Mental Health America released a first-of-its-kind dashboard that geographically maps results of the 2.6 million mental health screenings taken from 2020 and 2022. Using the screening data, Mental Health America and Mental Health America of Illinois synthesized analyses to provide community-level findings from Cook County and explored potential policy and programming opportunities to address mental health needs within both Cook County and Illinois. So I'd like to present our presenters for today, which are Mark J. Harriman and Maddie Reinert. Mark is a retired clinical professor from the University of Chicago Law School, where he taught policy and trained his students to be effective advocates for clients and mental health issues. Mark currently serves as the pro bono counsel for Mental Health America National. He is the board chair of the Public Policy Committee of Mental Health America of Illinois and serves as a facilitator of the Mental Health Summit, coalition of over 40 mental health providers. He is also a member of the Chicago Bar Association's Mental Health and Disability Law Conference and is a member and legislative liaison of the section on mental health law of the Illinois State Bar Association. Maddie of Mental Health America's national chapter serves as Senior Director of Population Health. In this role, she manages the MHA online mental health screening program, which we'll discuss today. She provides regular data support to over 80 partners nationally. She also supports the research and innovation and policy teams with researching, writing, and disseminating public health and policy findings. Prior to working at MHA, Maddie received her master's in public health with a concentration in law, policy, and ethics from the University of Virginia. She also holds a BA in psychology and global public health from UVA. So with that, we'd like to get started, and Mark or Maddie, whoever would like to begin, that would be great.
Thank you so much, Joyce, for that introduction. And thank you all again for being here today. Like Joyce mentioned, I'm Maddie Reinert. I am MHA's Senior Director of Population Health, and I am so excited to debut our new Cook County data mapping dashboard to you all. As we get started, I just also want to extend a quick thank you to Lundbeck for supporting this work, to MHA of Illinois for their partnership, and to MHA of the Northern Suburbs for hosting us today. And I will share my screen. All right, hopefully you all can see that. So to begin, MHA National is the nation's leading community-based nonprofit dedicated to addressing the needs of those living with mental health conditions and promoting overall mental health with a focus on prevention and early intervention. Again, I'm from our national office, but we have 200 wonderful affiliates throughout the country, some of whom I see in attendance today. As an advocacy organization and an organization that was founded in lived experience, we believe that our work should be person-centered and data-driven, and we strive to ensure that we are guided by what people who are seeking help with their mental health are telling us. Since our inception, you can see here in our policy agenda from 1913, MHA has been dedicated to making mental health a part of overall health in programming, policy, and practice, and screening individuals, particularly youth, for mental health conditions, so we can provide resources and supports to those in need where and how they want them as early as possible. A key part of MHA's efforts toward early identification and intervention for mental health conditions is our online screening program, which is a collection of 11 free, anonymous, confidential, and clinically validated screening tools that allow people to explore their mental health concerns online and receive immediate results and resources. We launched screening as part of our belief that everyone should have access to mental health screens and be able to get a greater understanding of their own mental health concerns on their own time. These are the same tools that would be used in a provider's office to screen for mental health conditions, but we've put them online where we found people often search for answers when they are first experiencing a mental health condition. As Joyce mentioned, since its launch in 2014, over 20 million people have completed a screen, and we've provided support to over 5 million users annually since 2021, making this the largest data set ever collected from a help-seeking population for mental health conditions in real time. So when someone comes onto our screening website, they can decide which of these 11 screens to take. You'll see we have screens on everything from depression, which we use the PHQ-9, anxiety, which we use the GAD-7, to bipolar disorder, psychosis, and even ADHD, which is one of our newer screens and has quickly become one of our most popular screens. So once they submit the screen, they're given their results, an explanation of how their screen is scored and what their result means, and articles, worksheets, and interactive tools that can provide more information about mental health generally and begin to introduce coping skills. On our end, we're able to receive de-identified data both from the screening tool itself and from a number of optional demographic questions that we ask after each of those screens. So those demographics include the standard demographics that you see here, like age, gender, race, ethnicity, and household income, to more information about whether they've ever been diagnosed with a mental health condition or if they've ever received any kind of treatment or support for mental health, to really in-depth information about special populations like students, veterans, LGBTQ+ individuals, healthcare workers, or trauma survivors. We also ask people if they are experiencing any comorbid chronic health conditions. And we've started asking people about why they're coming on to take a screen. We ask, what are the 3 top things that you think are contributing to your mental health problems while you're taking a screen today? They also include state and zip code information, which is how we've been able to drill down to the zip code level within Cook County in the data dashboard that we'll be exploring. And overall, all of this data helps us to understand people who are struggling with their mental health. It helps us answer, what are the mental health challenges people are facing? What is the current need and where? And how can we best provide people with resources and supports on the ground where they are? Our goal is to use screening data to rapidly analyze and disseminate information to help fill unmet needs and gaps in care for our communities. It can inform new policy decisions, the creation of new programs, better resource allocation, or it can tell us where there may be programs or policies that are working well that can be scaled to other spaces in the community. There are a few things that really set this data set apart that I think are important to keep in mind when viewing the dashboard. One is that it is largely reflective of emerging unmet mental health needs. The individuals who take a screen through this program often have very high symptom severity and no previous experience with mental health supports. So in 2022, for example, 78% of all individuals who took a mental health screen in the US scored with moderate to severe symptoms of a mental health condition. And of those individuals, over half, 54%, had never received any kind of prior support for their mental health. So what makes this data set really useful is that it can be used as a tool for that earlier intervention. We see that when people are first experiencing those very first symptoms of a mental health condition, they look for information on the internet the same way that we often Google symptoms of physical health conditions before bringing them to a provider. And this is important because most mental health data that we have access to is collected once someone has already presented in a health system. This data set is showing us more upstream imminent need for mental health supports in these communities. We've also found that people are more likely to turn to MHA screening when they don't know where to go or how to start getting help for their mental health, or for a lot of our users before they're even sure what depression or anxiety really means. Or we also see people come to MHA screening more often if they live in a mental health desert where services are not as accessible or available to them. So it can show where there is a need for more, again, those upstream supports like screening, mental health education, or improvements to access to mental health care. We're also able to collect and analyze this data in real time without the 2 or 3 year delay that we often face with other large scale mental health data sets, which allows decision makers to be even more responsive to those ongoing or emerging mental health needs while they're happening. We also want to stress that the data we have almost certainly undercounts unmet need in each community that you'll see in the dashboard. This is a convenience sample of help-seeking individuals, meaning it is showing data from people who have gone on to search engines like Google or Bing looking for mental health information and supports. So when we look at the data, it is interpreted as a minimum unmet need for immediate resources and supports within Cook County. For everyone we see on the dashboard who came on and took a screen, in each of the neighborhoods that we'll be looking at, there are likely many more individuals who are currently struggling with their mental health and just haven't found screening. We started this work also with support from Lundbeck by mapping the MHA screening data at the state and county levels across the US, but we really wanted to turn our focus to a more local approach where we could really share this data with stakeholders on the ground within one county and try to come up with even more specific recommendations based on our findings. And we chose Cook County because when we did the initial national data mapping work, it was among the top 20 counties with highest rates across several conditions, including suicidal ideation, severe depression, and PTSD. So in 2022, MHA began working with Mental Health America of Illinois to lay out that framework for building a local dashboard and developing an actionable pathway to support policy and programming opportunities within Cook County. We began this work by reviewing and validating MHA screening data against publicly available data sets, primarily US Census data, and then conducted interviews with stakeholders representing schools, mental health providers, and government systems, exploring the ability to use the data in, again, expanding those legislative opportunities, growing needed programs, and strengthening policy at the local level. This work culminated in a report with findings from the Cook County data and recommendations for policy changes based on those findings, and this public data dashboard that we'll be viewing today. I do just very quickly want to talk about some of the demographics that we've seen in our Cook County data out of MHA screening. Again, these data are de-identified. Provision of demographic data is completely voluntary, so people can just take a screen and submit it without answering any of those demographic questions. But we do find that most users, up to 80%, do answer at least one of the demographic questions. So we do have a lot of demographic information to go off of. Like we see in our national data, users in Cook County screen more often for depression than any other condition. But a little bit different from our national data, we saw in Cook County 28.4% of users were youth under 18, And really the largest age group were young adults ages 18 to 24. Nationally, we tend to skew a bit younger, with about 38% of our overall users being youth under 18. So in Cook County, we're seeing a bit higher of a need among those transition age youth and young adults than we do nationally. We also saw 41% of screeners in Cook County identified as white, followed by 24% identifying as Hispanic or Latino, and 18% identifying as Black or African American. 55% report a household income under $60,000. And overall, when we were looking by neighborhood, we found that individuals with those lower incomes were more likely to screen at risk, especially when residing in higher income neighborhoods. And when we validated our demographic results, we found that they were consistent with US Census demographic breakdowns by zip code and that stakeholder feedback. So now we can turn to the dashboard and explore some of what we're seeing as clusters of high risk within Cook County. This dashboard is available both on the MHA National website and the MHA Illinois website, and we will put both links in the slides at the end of this presentation and in the chat. So let me share. All right. So again, this Cook County dashboard contains that self-reported de-identified data that was collected on MHA Screening between 2020 and 2022. For all of this data, we followed an extensive cleaning process based on the guidance we received from epidemiologists we had worked with previously during our national mapping work. This dashboard provides a visual representation of the rates of depression, anxiety, PTSD, and psychosis here on this mental health conditions tab. So while you're on this view, you can use the screen filter here to switch between each of those conditions, and those are each from that individual screen. We also have data on suicidal ideation under this tab, which contains all data from people who took a depression screen and answered question number 9, that they were experiencing thoughts of suicide or self-harm more than half or nearly every day of the previous 2 weeks. And then we have data on trauma survivors, which is derived from those who are self-identified as trauma survivors in that special populations question following any of the 11 screening tools. So each of these maps that you'll see rank those zip codes within the county based on the number of people scoring at risk for that condition divided by the population residing within the zip code to get at a positive rate per 100,000 people by zip code. Zip code areas are color coded based on percentile. So the rate in each zip code is being compared to all other zip codes in the county. For example, here on our anxiety view, we are seeing zip codes with the lowest number of people scoring at risk for moderate to severe anxiety per 100,000 people presented in that light blue color, to zip codes with the highest number of people scoring at risk for moderate to severe anxiety per 100,000 in that darker blue. For all dashboards to ensure user privacy, we built in data suppression so that zip codes were only included in the analysis if they had 5 or more individuals with a positive result. So you will see that not every zip code contains data in every dashboard or under every filter. For each of the conditions, you'll immediately see the map and then a table, which has the zip codes ranked again from those with the highest number of people scoring at risk per 100,000 to lowest. And then we do have a column here called positive result, which has a raw count showing just how many people took that screen in that zip code and received a positive result during the time. You're also able to use an age filter on each one of the dashboards that we have and can view risk by age group. So we have across all ages and for adults, and then for youth under 18. And as you switch between these, you'll be able to see those clusters of high risk change. So for example, for anxiety, If we're looking across all ages, we can start to see clusters immediately around the Chicago neighborhood around the Loop, a bit northern Chicago. We see a cluster here in Elgin, Streamwood, and Hoffman Estates, and then into Elk Grove Village and Des Plaines. But for adults, we see those clusters change a bit. So they become much more pronounced, again, in the areas around the Loop and a bit more in northern Chicago. And then we still see that line of really high risk neighborhoods, basically from Elgin through to Des Plaines again. But when we switch to youth, it looks pretty different. So we can see that a lot of those high rates of anxiety, there's much less anxiety for youth in those Chicago neighborhoods around the Loop. And we start to see higher clusters of risk in more northern parts of the county around Wilmette, Glenview, Morton Grove. We do again see a bit of a cluster here around Elk Grove Village and Des Plaines, even for youth and anxiety. And then some clusters in the southern areas of the county, like Calumet City, South Holland, and even Chicago Heights. So using this age filter for each of these conditions can help us start to narrow down what kinds of really age-specific supports may be needed and where within the county. So now I'll switch to depression and we can take a bit deeper of a dive. So this map is showing the number of people scoring at risk for moderate to severe depression per 100,000 people. So those are people who took that PHQ-9 depression screen. 12 of the top 20 zip codes with the highest rate of people scoring with moderate to severe depression were in Chicago. And that overall top zip code for all ages, and when we look for youth under 18, was 60603 in Chicago. So I just want to note that we do calculate the number of people scoring at risk by population because it can show us where there is a disproportionate number of people experiencing mental health challenges. For example, we see that there are 10 youth here from that 60603 zip code in the Loop, scoring at risk for moderate to severe depression. That may seem like not a very large number, especially when compared to somewhere like Elk Grove Village, where there are 72 youth scoring with moderate to severe depression. But it's all calculated based on population size. So according to the 2021 American Community Survey population estimates, only about 134 youth ages 5 to 19 live even in 60603 in that zip code area. So this is showing that at least 7.5% of the youth population in that neighborhood is experiencing moderate to severe depression. And again, the data collected from MHA Screening represent individuals with the highest need who are actively searching for mental health resources online. So for every 10 youth we see scoring at risk in this data, there are likely many more who are struggling with their mental health with moderate to severe depression and just haven't found our website, indicating that there is likely a much higher need for immediate mental health resources for the youth in that area. So while looking at these individual zip codes can give us valuable information about the need there, what is also important here, as with all epidemiological research and as we just looked at with anxiety, is to look at the clusters. So the clusters of high-risk zip codes can tell us where those additional resources may be needed, where mental health resources are not as available or accessible, or even from a population health standpoint, where there could be something structural, social, or even in the physical environment that may be affecting mental health more. So when we are looking at depression in the overall map, we do see an area in high need in Chicago around the Loop in that northern Chicago area. Like anxiety, we also see a bit of a cluster around the Chicago O'Hare Airport here with Elk Grove Village and Des Plaines. But then different from anxiety, we also are starting to see a cluster in southern Cook County in Frankfort, Madison, and Tinley Park. So each of these areas are places that warrant that additional attention when deciding where to distribute additional mental health resources. One of the primary use cases we have found in this data is in planning and implementation of crisis services around 988. So if we look at our suicidal ideation dashboard, we can see by zip code where there may be an imminent need for more either suicide prevention resources or resources along that continuum of crisis care that we've envisioned as part of 988, like mobile crisis teams. When we filter this by age, so if we look at youth, for example, those clusters of suicide risk start to look even more pronounced. For youth, again, we're seeing a bit of a hotspot here in Elk Grove Village, but it seems there are much larger clusters in southern Cook County. So again, in that Frankfort, Madison, and Tinley Park area, through South Holland, Calumet City, and then up into Chicago. And we also see a little bit of a cluster in Chicago here as well. So this data can be useful as part of those spatial gap analyses that have already been proposed as part of 988 when making decisions about where to first allocate those crisis resources. And my colleague Mark Hireman will speak more about that in a bit. Another capability we have with the data we and our affiliates collect is once we've identified these clusters, we can really dig into that additional demographic data to understand more about mental health needs in these areas. So, for example, around the Loop in Chicago, we saw consistently high risk based on the number of people who live in those zip codes. We know that for the last 10 years, the Loop has been the fastest growing neighborhood in Chicago. And even during the COVID-19 pandemic, there was an influx of new residents, both from out of state and from individuals living in Illinois who wanted to move closer to that downtown area. And now we're seeing that high rate of mental health needs based on the population during that same time period. So in our demographic questions, again, one of the things that we ask is what are the main things contributing to your mental health problems right now? People can either choose from a list of options that we provide that we've written out based on what we saw people reporting most often, or they can write in their own response. So of those who selected from the options provided, we saw the two most reported problems from people living in the Loop were relationship problems and loneliness or isolation. Both were selected overall by 45% of respondents. But when we broke it down by age, we saw that those young adults, 18 to 24, were much more likely to report loneliness. And adults over 24 were much more likely to report those relationship problems. And so here, once we start to really look into what they're writing in, we can start to see those other common responses. So here we see a lot around work struggles, job hours, stress, everyday tasks, and then family again was definitely a contributor here. And then we can even see some people reporting issues related to those social drivers of mental health, like isolation, feeling alone, loss of housing. So knowing this additional information, we can start to ask, what does workplace mental health look like in this community? Are there mental health services or protections in place for people who are working and living there? What does childcare, housing, or other supports look like that could help with that stress people are experiencing? And then even when we start to think about that isolation loneliness piece, is there a way we can increase connectedness and reduce isolation for people, especially those young adults that we see reporting isolation much more often? We also looked at Elk Grove Village because it was a neighborhood that we also saw consistently showing higher risk for depression, anxiety, and suicidal ideation, especially among youth. So we saw Elk Grove Village had the second highest number of youth scoring with moderate to severe depression per 100,000 residents, and about half of those youth who took a depression screen there reported experiencing frequent suicidal ideation. And when we look at the demographic makeup of that area, 71% of households are occupied by families, and children of those families are really the ones that we can see in the data struggling most. So when we asked those screeners the same question about the things contributing most to mental health problems, we saw that among youth and young adults, it jumped to over 60%, indicating that loneliness was one of the main things contributing to their mental health problems. And here we can see from those write-in responses, things like issues with school, extracurriculars, work, burnout, and family again. So these findings can help us think through resources to support full families, understand the challenges faced by children of working parents as they navigate those school, work, and social responsibilities post-COVID, and explore opportunities to invest in mental health promotion in these spaces where youth are telling us they're struggling. And I show this just to demonstrate the power of this data and how it can move us from understanding through the dashboard where greatest risk is to then going further into the demographic information to see what people are telling us is contributing to their mental health challenges, so we can start to make those really specific changes. And again, our hope with this dashboard is to make this kind of mental health data more accessible to community leaders and policymakers, so we can have a better understanding of mental health need and provide services and supports where they're most likely to reach populations at greatest risk. And so with that, I will turn it over to Mark from MHA Illinois to walk through some of our policy recommendations.
Thank you so much, Maddie. So we are lucky that we already have in our legislature and have had for a number of years two standing committees, one in the Senate, one in the House, that are devoted to mental health issues. And these committees have worked on pretty much a bipartisan basis, which is surprising in these days, but we're happy that that's happening here in Illinois. And so as the data shows, the largest volume of unmet need really is among young people, whether they're grade school, high school age, or college in their 20s. And thankfully, we have already pending and moving through the legislature some legislation that is supported by the two committees that I mentioned that are designed to help with youth. And I think mental health groups across the state are supporting this legislation. For example, the first one you see listed there, the Mental Health Equity Access and Prevention Act, House Bill 2847, is important precisely because it allows wellness visits to be, it requires wellness visits to be, for mental health issues, to be covered by insurance. They have always covered this for people with non-psychiatric illnesses. You can get, Medicare covers this, and insurance usually will cover one wellness visit, but not for mental health issues. And now this legislation will require it for mental health issues. And that's important because, as our screening data shows, many of the people who come to us have never had any connection to the mental health system, may not understand that they have a mental health situation of any kind, that they have a need for mental health. But if they are experiencing some kind of discomfort, they can go and get a wellness visit covered by their insurance. And similarly with House Bill 3977, this requires that clinical sessions be covered for people that don't have a diagnosis. And again, people often come to the mental health system not understanding that they have a diagnosis. Why should we expect them to? Not everyone needs to be an expert in how to diagnose their mental health condition. They need to be able to find help even if they don't have a diagnosis. So those are two very important bills. I would also point out there's another bill not on this list, that Senate Bill 1709, which requires the Department of Human Services, Division of Mental Health, to work with the Department of Education to provide technical support to schools so that they can help schools across the state identify mental health situations and respond to them. Then let's go to the next slide if we could, Maddie. So as many people know, one of the most important things that's happened in the past year across the country, but certainly important here in Illinois, is the implementation of the new 988 system. That system allows people to call this 988 number, and it replaces an old 10-digit number, so it's easier to call. But more importantly, we have gotten substantial federal funding to implement 988. And 988 is going to do and is already doing three things. One, it's a number to call. Two, it's a person to send. And three, it's a place to go. Rolling out this entire system is going to take some time. Illinois is well on its way, but it needs to get a lot further down the road. So among the things that we have already dramatically improved since we implemented this a year ago is that people are actually answering the 988 number. Illinois was ranked last in the country in the number of people who called our suicide hotline and had their call answered by someone inside Illinois. And now we have overwhelmingly, if you call 988, the call will be answered by someone here. But we still need a lot of work to find a permanent funding stream for this. The federal funding will disappear. And so Illinois, like every other state, is going to have to figure out how to fund this. Senate Bill 1403 creates a task force to help monitor and make sure that this is properly implemented. And then House Bill 3230 is about figuring out exactly what the costs are and what we will need to implement this in a very detailed way. Both of these bills are likely to pass. I encourage you to communicate to your legislators to support them. They've already passed. Each of these bills has already passed out of one house of the legislature and moved on to the other. Another important aspect of this is to make sure that people get all kinds of treatment. And some people with mental health conditions will need medication. Another bill that we have pending in the legislature is House Bill 2456, which removes impediments imposed by Medicaid to accessing psychotropic medications by removing the requirement of prior authorization. So again, we need to have a full continuum of crisis services for children's, adolescents, and families. And then let's move on to the next slide. As I think many people know, one of the biggest problems across the entire country, but certainly here in Illinois, is the absence of sufficient volume of mental health professionals of all types. And one of the things that we have done in Illinois and that our national is working on across the country is to provide peer services to help supplement professionals. So Medicaid in Illinois and in many other states, but more importantly here in Illinois, will cover peer support services. We have a training program for peer support services. But we also have a couple of other bills that are pending that I think are likely to pass. House Bill 2173 increases Medicaid rates for a variety of necessary community services, including crisis services. And then Senate Bill 57 expands loan repayment for substance use counselors. So one of the problems is that people often go into debt when they're trying to become mental health professionals of whatever kind, whether it's psychiatrists, psychologists, social workers, counselors. And one of the ways to help deal with that problem is to give loan repayment for people who go into the public sector, for people who help serve those most in need. So what I would like to say a few more words about in the time we have remaining, and then we'll be happy to answer. I know there are already questions in the chat and probably more coming. So how can we use this data in a generic way, in a general and specific way in Illinois and in Cook County particularly? Well, we can think about three groups of people that are important, and they overlap to some extent. One group of people that is most important is we have a wonderful group of service providers, community mental health providers across the county and across the state, and they can use the data to find out where their services are most in need. We have large providers and small providers, but we have providers, for example, that provide services across many zip codes in Cook County and even across counties. And they need to be able to know what kind of particular services are needed in what zip codes. Secondly, we of course have funders, and that's primarily the government, but also insurance companies need to know where to spend their money. And so this can provide important information, whether it's to the city of Chicago, which funds mental health services, the county of Cook, which funds mental health services, or the state of Illinois, which of course funds mental health services. And then, of course, on a larger scale as well, we need to think about how to do advocacy with government. And here we can reach out to our legislators and say to a legislator, here is the unmet need in your legislative district, whether it's a state representative or a state senator. We can say to Cook County commissioners, every region in Cook County is represented by a commissioner, and we can talk to her or him and say, here's the unmet need in your district. We can also say that to aldermen inside the city of Chicago. And then we are also lucky, some years ago, I'm proud to say that Mental Health America of Illinois took the lead in creating this law. We have something called, that are referred to as 708 boards. That's allows cities, counties, townships, and now neighborhoods within Chicago to, through a referendum, tax themselves to provide mental health services that they can decide what kind of services are needed on a local level when they find that maybe the state isn't spending the money the way the local community needs it, whether it's a neighborhood of Chicago, a township in the suburbs, or a city in the suburbs, or a county outside of Cook County. And those 708 boards can then decide how to spend their money. And we as advocates and as people who care about the mental health system can communicate our needs to them. So I think we have lots of work to do with this data. And of course, we can, one of the things we know is that schools are a tremendous place where we have unmet mental health needs, so we can talk to our school boards, whether it's the Chicago School Board or the school board in any one of the many townships throughout Cook County or throughout the state. And that's another place to go to say, look, here's the data from your township. Here's the data from the school that serves your community. Here's the unmet need in that community. And we can present that data to them. So this creates a tremendous opportunity for us to do lots of work. And so we will have to figure out what our priorities are, and the data helps tell us what those priorities should be. So I know there's some questions already asked in the chat, and maybe, I don't know if Maddie, you want to respond to some of them, or one of the questions was, for example, Cook County's #3. Do you know who #1 and #2 is?
We'll have to look back. I believe one was Maricopa County in Arizona. So definitely some of the larger counties in the US are the ones that came up. I would think also like Los Angeles was somewhere in that top, but I can't remember where.
The other one is about trauma survivors. Maddie, trauma survivors numbers are very much underreported on the west side. Do you have any thoughts about why that might be?
Mark, you may be able to speak more on what is happening on the west side, but one of the things that we did see with trauma survivors is a lot of where the high risk is clustered is around some of the college campuses. And we do see higher rates of that same young adult age group, 18 to 24, reporting experiences of trauma. So that's kind of where we have seen the highest risk centered around is those young adults around college campuses saying that they've experienced a trauma.
So there was a question about how you contact your local 708 board. And so I don't have the link to that, but you can find it fairly easily. There's an organization called the Illinois Association of Community Mental Health Associations. And they're the trade association for all the 708 boards. And they have a map of the state, which you can hover over and find whether there's a 708 board that covers your area. There isn't a 708 board for every area in Cook County or in the city of Chicago, or for that matter, throughout the state. But a substantial percentage of the state is covered either by a county 708 board, or primarily downstate, a township 708 board, or a city 708 board, or in Chicago, you can have a neighborhood 708 board. So you can find that information out from the Illinois Association of Community Mental Health Associations, IACMA.
Right.
Which is fairly easy to find. And I'm sorry, I don't have the URL.
Yeah, I hope that was helpful to who asked that question. There's another question in the chat regarding, do you
Yes.
have numbers specifically on youth in care?
Yes, so because we asked that one question about whether someone has ever been diagnosed with a mental health condition or if they've ever received treatment or supports, we can drill down to looking at youth who are in care. We also have a question if they say yes, they have received treatment before, if they're currently in treatment. So we can see where people are screening there as well. I will say for youth, it's pretty uncommon with our data set that they are in care. We just, by nature of how people find our website, it's generally from searching like, do I have depression, or depression test, or some other phrases that we have are like, am I stressed or depressed, or I can't get out of bed. So most of the people that we serve are still at the very, very beginning of their experience with a mental health condition, where they aren't in care or may not even know what's happening. They're just starting to experience symptoms and are looking for that kind of information online. So the vast majority of the youth that we serve are not in treatment, but we can always drill down in those demographic questions to see who's in treatment. And then we have questions about like why they would be coming on to take a screen. And for most, we see either they're in treatment and they don't feel like it's working, or they just want to check on their mental health and see kind of how they're progressing with this screen over time.
And can I back up a minute? Matt Maloney has kindly put in the chat the URL for the Association of Community Mental Health Authorities. It's www.acmhai.org, but you can see it in the chat. Matt Maloney represents them in Springfield, and so knows them well.
That's great. Can you, Maddie, also reiterate how the per 100,000 calculation was done? Can you go back to that for a second?
Yeah, so we took the number of people who had scored at risk for the condition and divided it by the population living in that zip code, and then multiplied that by 100,000. It's kind of the like wonky, the public health calculation for rates of a condition. So it's basically just creating a standardized rate that we could look across all zip codes with all kinds of populations and be able to compare them to one another.
Okay.
So it's almost saying like, if like for every 100,000 people, if they lived in that zip code, how many would come out with this positive result?
Okay. Another question is there a local data dashboard available for DuPage County? Do you have that developed?
So this is our first super local, like within one county at the zip code level dashboard. We do have another dashboard that maps across the US at the county level, but doesn't go into zip code. We are exploring this local approach. If you are interested in getting a more local dashboard, we're happy to talk to you and I say yes, set up how we could explore that with your screening data, but it's definitely something that we're starting to move into if people are interested in getting even more local data. So I'll put my email in the chat, Annie, and you can reach out.
So much. This is really awesome.
Are there any additional Wait, here's another question that I think may have just popped up. Where would people be able to access this recording? Because someone would like to share it with their colleagues. I think it's incredibly important information. Is there a way to do that? That we could locate this recording? Or can we share it?
Sorry. Yes, I'll put my email address in the chat. Individuals can email me for a copy of the recording, Mariah.
But again, the screening data is available both on Mental Health America's website, and it's also available on Mental Health America of Illinois' website. And we will be sharing the PowerPoint presentation after this with everyone who participated. And it has Maddie's email on it, and it has my email on it. And if you email either of us, we'll be happy to respond with any information we can help you with that we have.
Okay. So I just want to, reiterate how important this information is and how useful this can be in terms of really assessing how we provide services effectively in a critical time for us in terms of our population mental health needs. So I want to thank you both so much. I think we have one last question. Where to get the informed consent that is not yeah. Jean, do you want to talk about that for a second? Not HIPAA?
Yeah, it's kind as a supporter, I don't have much information by law, and I'm just get information. But if it is very important to get the clinical side in field to support the family. But I have a HIPAA issue I cannot disclose. But it is the field be a supporter to family with mental health, a lot of undisclosed, so they cannot get the right treatment.
So that's really beyond the scope of this presentation, and it's a very complicated question about when you can share information. Again, if you want to send me an email, I'm fairly knowledgeable about the confidentiality laws in Illinois, and if I can help you, I will try to do so.
Okay. Even the family member, just not much I can do.
If you email Mark, he'll be happy to address what he can with you.
All right. Thank you very much. And it's very good to spread up because a lot of families struggle
Absolutely.
with mental health.
Absolutely. Well, thank you again to Maddie and Mark and to all of you who joined us today. We really appreciate you coming and learning from our Lunch and Learn. So thanks again.
Very useful. Thank you.